Hey friends, Amy McMillan here, mobile vestibular therapist in Northeast Ohio. Today I'm bringing you a video about how to prevent falls backwards. So with dizziness and balance disorders, you can fall any which direction, backwards being probably the most fearful. It can happen with a multitude of conditions, including neurologic disorders, just aging, disequilibrium, or some vestibular disorders. So if you find that you consistently tend to fall back, we are going to cover what you need to do to combat that in an exercise routine that you can complete in 5 to 10 minutes every day to strengthen your core, get those muscles on the front of your body activated again to prevent those falls backwards. So I want to talk just a minute about what muscle groups may be weak that's promoting a fall backwards. So that information may be coming from the brain kind of pushing you backwards, and you need to have a strategy to fight that sensation, or you may be deconditioned in the muscles in the front of your body and your calves that prevent you from falling backwards. Now, when it comes to preventing falls, we need to have a good center of gravity. So making sure that your weight is right in the center of your spine and your feet and not already falling back. We also need to make sure that you have good, strong corrective strategies. Your balance strategies come from your ankles, your knees, and your hips. So I'm going to give you a program that hits all three of those strategies so you can best improve your balance and feel confident with walking. We first start with center of gravity training. I call this the clock exercise, where you kind of take inventory of where you feel your mass in your feet and try to shift forward and back, eventually trying to find the middle. Next, we're going to strengthen the calves. So these are the muscles that can react and make sure they propel you forward instead of falling back. Follow this up with your anterior tib strengthening, the front of your shin. Then we'll follow this with hip sways, where we try to take our pelvis, reach back, and then forward, trying to get full motion out of our ankles and hips. Now the next portion is all resisted walking. The band is going to be around your back or chest, depending on the direction that we're going. Try to go very slow and controlled. Use a partner if needed. You're definitely going to feel this around your core. So you can do this backwards, forwards, and sideways. And I think forwards is probably the most challenging, especially because you have to use your core and control yourself on the way back. That band is going to be pulling you back. You already have a tendency to fall back. So make sure you prepare, contract the front of your body, and slowly walk yourself backwards. The last exercise I like is just a simple chest press, where we're trying to engage your core as you, again, fight the band from pulling you backwards. Now that last piece you're gonna practice in preventing falls backwards is putting it all together. So find a wall or a table, maybe a couch that you can stand close. Put your hands near it. Open your feet about shoulder width apart. Anticipate that fall backwards as you look up slowly and try to use your abdominal and front leg muscles to combat that fall backwards. So look up and then back down, trying to keep your weight in the middle of your foot and trying to avoid that tendency to fall backwards. So you're going to do that about 5 times, just challenging yourself to move your head quicker and more normal, basically, until you can prevent those falls backwards. So hopefully you found those exercises helpful to reduce your risk for falling, keeping you more balanced and confident on your feet. If you have any questions, drop them in the comments below. Make sure safety first. If you need a partner or a chair beside you, always start slow and make sure you work up to what I'm showing you in the video.